Hello, gentlemen, if you're in your 50s, 60s, or even beyond, and you've started to notice that your intimate experiences feel a little different than they used to, then this message is especially for you. Maybe everything still feels normal at first. The connection is there, the buildup feels familiar, and you still reach that moment of climax. But then something catches your attention. There's little or no fluid released. That small difference can trigger a big reaction. For some men, it happens just once and creates immediate concern. A thought appears. Is something wrong with me? For others, it becomes a repeated pattern, something they quietly notice but don't talk about. It can bring confusion, anxiety, or even a sense of embarrassment that's hard to express. Let me start by saying this very clearly. You are not alone in experiencing this, and it does not mean your masculinity is fading or your intimate life is over. I'm Dr. Rubby, and for over a decade, I've worked closely with men navigating these exact concerns. Today, I want to walk you through what's happening in your body in a way that is honest, supportive, and easy to understand. Because once you understand what's going on, the fear begins to fade, and clarity takes its place. Now, before we talk about why this happens, let's take a moment to understand how things are supposed to work. Think of your reproductive system as a carefully coordinated process. Each part has a role to play. The testicles produce sperm. The seminal vesicles create the majority of the fluid that carries and nourishes those sperm. The prostate adds its own protective secretions. All of this combines into what we commonly recognize as semen. When you reach climax, a series of precise muscle contractions push this fluid forward and out of the body. It's a fast, automatic process, something most men never think about because it just works. But here's something many people don't realize. Climax and ejaculation are not actually the same thing. Climax is the sensation, that peak moment of pleasure driven by your brain and nervous system. Ejaculation is the physical release of fluid. Most of your life, these two happen together so seamlessly that they feel like a single event. But biologically, they are controlled by different mechanisms, and that's why it's possible to experience one without the other. What we're focusing on today is a condition often called dry ejaculation. This is when a man reaches climax and feels the full sensation of pleasure, but notices that little or no fluid is released. Many men describe it as an empty orgasm, and understandably, that difference between expectation and reality can feel unsettling. But here's the key point. Your ability to feel pleasure is still intact. What's changed is not your capacity for intimacy, but something in the physical process behind fluid release. So let's break down the 3 most common reasons this happens. The first, and by far the most common, is something called retrograde ejaculation. To understand this, imagine a small muscle at the base of your bladder acting like a gate. During ejaculation, this gate is supposed to close tightly. That closure ensures that fluid moves forward and exits the body. However, if that muscle doesn't close properly, the fluid takes an easier route. It flows backward into the bladder instead of outward. The result? You still feel the climax exactly as before, but externally, there's little or no fluid. Some men notice a clue afterward. Their urine appears cloudy. That's because the fluid has mixed with it inside the bladder. It may sound alarming, but in most cases, it's harmless. Retrograde ejaculation can occur for several reasons. It's often seen after certain surgeries involving the prostate or bladder. While those procedures may be necessary and successful, they can sometimes affect the nerves that control this mechanism. It can also happen as a side effect of medications, particularly those used to treat high blood pressure or prostate enlargement. These medications relax muscles in the body, including that small but important valve. The second major cause involves blockages within the system. In this case, your body is still producing fluid, but something is preventing it from passing through properly. Think of it like a pipe that's partially blocked. The production is happening behind the scenes, but the delivery is restricted. This can be caused by past infections, inflammation, or scarring within the ducts. In some cases, tiny calcifications, similar to very small stones, can form and interfere with the flow. The signs here are often gradual. You might notice that over time, the volume decreases more and more. Some men also report a mild discomfort during climax that wasn't there before. The encouraging part is that many of these blockages can be treated. Depending on the cause, doctors may recommend medication to reduce inflammation, or in some cases, minimally invasive procedures to restore normal flow. The third key factor to consider is hormonal changes, particularly involving testosterone. Testosterone plays a much bigger role than most people realize. It doesn't just affect desire, it supports the entire reproductive system, including the glands responsible for fluid production. As testosterone levels decline, which can naturally happen with age, the system begins to slow down. At first, you might notice a reduction in volume, but over time, it can also affect libido, energy levels, muscle strength, mood, and even the intensity of climax. This condition, often referred to as low testosterone, is more common than many men think, and importantly, it is treatable. With proper testing and medical guidance, hormone levels can often be improved, leading not just to better sexual function, but also overall well-being and vitality. Now, while these are the most common causes, there are situations where dry ejaculation can signal something more serious. If the change happens suddenly and is accompanied by symptoms like pain, blood, fever, or numbness, it's important not to ignore it. Conditions such as nerve-related disorders, long-standing uncontrolled diabetes, or in rare cases, more serious urological issues can interfere with these processes. That's why paying attention to your body and seeking medical advice when something feels off is always the right step. But beyond the physical causes, there's another side of this that we can't ignore: the emotional impact. For many men, ejaculation is closely tied to identity, confidence, and a sense of performance. When that changes, it can create self-doubt or even a feeling of loss. Some men begin to withdraw from intimacy altogether, not because they've lost desire, but because they're worried about how the experience has changed. And that silence can make the situation feel heavier than it really is. Here's what I want you to remember: your value, your masculinity, and your ability to connect are not defined by a physical outcome like fluid release. Pleasure, connection, and intimacy are still very much available to you. Understanding what's happening is often the biggest step toward regaining confidence. So let me leave you with a simple and practical plan moving forward. First, don't ignore the change. If this is happening consistently or suddenly, it's worth getting checked. A basic evaluation, along with simple tests, can often identify the cause quickly. Second, take control of your overall health. Conditions like diabetes, high blood pressure, and cholesterol directly affect blood flow and nerve function, both of which are essential for normal sexual health. Third, talk about it. Whether it's with your partner or your doctor, opening up removes the burden of uncertainty and allows solutions to come into focus. You don't have to carry this silently. In closing, I want you to see this not as a loss, but as a message. Your body is giving you information, and when you respond to it, you regain control over your health and your confidence. I've seen many men go through this exact experience, and with the right understanding and support, they come out stronger, more informed, and more at ease with their bodies. Your vitality is not measured in what you see physically, but in how you feel, how you live, and how you connect with others. So don't let fear or embarrassment hold you back from seeking answers. Because in most cases, there are solutions. And more importantly, there is reassurance. Your best years are not behind you. With the right approach, they can still be ahead. Take care of your health, stay informed, and stay confident. I'll see you in the next one.